Right now, turning to the coronavirus, California has lifted its stay-at-home orders. Starting immediately, barbershops and salons can reopen at 25% capacity. Churches and gyms can open, but outdoors only. Family entertainment businesses such as miniature golf and batting cages can open outdoors at 50% capacity. And up to 3 households can now gather outside as long as it is limited to 15 people. And starting this Friday, LA County is allowing outdoor dining to resume. Every other county in our area, along with the city of Pasadena, has allowed outdoor dining to resume immediately. And as restrictions ease a little, is that a sign that there's light at the end of the tunnel? We hope so. And what can people do to lower their risk of being exposed to the more contagious variant? We're talking to Dr. Nicholas Testa, Chief Medical Officer at Dignity Health, Southern California. Good morning to you, and thanks for joining us. Great to see you. Hospitalization numbers seem to be coming down, and yesterday some restrictions, as we've been saying, were eased. Have we turned a corner?
I don't think we've turned a corner. I think we've stepped away from the precipice. So if you look at the numbers, at our height in early January, we were at 8,000 COVID hospitalizations across Los Angeles. We're down to about 6,500. We're seeing about 100 to 150 less hospitalizations per day, which is great. But remember, in October, September, when we were at our lowest, we were at about 1,000. So we have stepped away from having to ration care, but we're far from having turned that corner, in my opinion.
Okay. Many people are anxious to get the vaccine, while others, even some healthcare workers, are reluctant to get it. What's your message to them about the vaccine and its safety?
So I think the reluctancy around the vaccine, as you said, Giovanna, comes back to the safety. And there's 2 real main things I think we get concerned about. One is mRNA. It's new. And then the other one is that the speed that we saw the vaccine developed. So what I have to say about the mRNA vaccine is it's actually not that new. We've been making mRNA vaccines since the early 90s. So there's really a breadth of research on the safety of the mRNA vaccine that I think gets glossed over because we've never done it on this scale. The second part is the speed that the vaccine was developed gives people pause. And, I think we have to remember that the mRNA vaccine allowed us to create a vaccine in just weeks when previously it's taken years. So that ability is really what sped the process up. In addition, we were able to stockpile production while we ramped up because we were in this crisis. So I just think people need to take that into consideration. And then finally, I'd just like to make this point that when we talk about educating ourselves about the vaccine, I really encourage people to go to academic resources, go to health centers, go to medical societies, avoid the internet and social media that can sensationalize some of the more, concerning aspects without really validating it in data.
Yeah, okay, that is very good advice. Thank you again, Dr. Nicholas Testa, Chief Medical Officer with Dignity Health, Southern California. Thanks again for joining us. Good to see you.
Thanks, good to see you.
Good to see you.